Hi, everyone. My name is Kunal, and I build product at Spruce. For those of you that don't know, Spruce is an all-in-one communications platform for any medical practice. We've been building Spruce for 5 years now, and are really fortunate to call so many of you in the crowd our partners. It's so energetic to come out here and speak to so many of you, and we've had the opportunity and the privilege to grow with you as you have grown your practice. So thank you for being part of this community, and it's a huge privilege for us. Um, as we've deployed Spruce to many practices, we've learned a ton about what it means to build DPC-grade communications, which essentially means communications designed around the patient-provider relationship. It's all about patient access, improving the patient experience so it matches up to how we as consumers think about interacting with the world and businesses, while increasing efficiency for the care team. It's important for all those factors to play together to really build communications that can match up to how you're delivering care today. I'd like to give a story about award-winning Dr. Rob Lambert's here. He already had, we already heard some of his data about his practice. He's got a practice in Augusta, Georgia, with Jamie and Jen, where he has, over the course of the last 6 years, grown his practice to over 800 patients. And what's interesting about their practice is that they're spending more time, they're interacting with more patients over calls and messaging on a daily basis than they are in-person visits. And that just goes to show how drastically care delivery is changing over the course of time. And I'm sure that for those of you that have been practicing in the DPC model over the years, that's not an uncommon story. So if you think about, if the care delivery mechanisms are changing, the tools that you're using to communicate with your patients have to keep up. They have to evolve alongside you. And this is something which we are super fortunate for our partners. They keep pushing us to take us to the next level of what is needed. So we started off with communication, trying to consolidate the different ways that US practices communicate so that you can increase access for patients. Your phone system, SMS, video calling, secure messaging. But that's just the beginning. How about giving your care team the ability to collaborate around those communications, just like you can in your EMR? And then giving you efficient ways to deliver care when it comes to communication tools, be it taking a picture, a video, an asynchronous information intake from a patient. And then as you grow your practice, managing that patient population as it continues to scale. But instead of me diving into the details of the words that you see here, what I'd like to do is focus on 3 aspects that I think bring to life what it means to have DPC-grade communications, which is the concept of a team inbox, your phone system, and messaging. So let's dig in. So let's talk about the team inbox. So if you're increasing access for patients so that they can communicate over video calls, your phone calls, SMS, secure messaging, you don't want disparate tools for patients to communicate with you. Instead, it should all be combined in a single tool with a single login experience for US providers. And also, it shouldn't just be living on your cell phone. The call history should not be on your cell phone. The voicemail should not be on your cell phone. It should be in this shared inbox, which any member of your care team can pick up, send a message to the patient, respond to the phone call, all of that information automatically being logged in that team inbox so that any member of the care team can pick up where someone else left off. I love this quote by Dr. Steed from Walden DPC, one of our customers, where he says, DPC is all about team-based care. You want your digital tools to live up to that expectation that you have for your team and for your patients. So you can provide communication capabilities, but it's even more powerful when you're able to provide collaboration capabilities around that communication. So one of the things that we do in Spruce is we let you send internal notes alongside the patient communication. So as you're interacting with patients over SMS, you can have an internal note for yourself or create a task for another member of the team, all in one communication stream. And when you do that, what you're doing in turn is actually creating a communications record digitized for you, no matter where you go, accessible on your smartphone. So that's the other aspect. If you're increasing access for your patients, and your patients can access your practice on their smartphone, why can't you access your tools on the smartphone? That should just be table stakes when it comes to how you communicate with your patients. And so the smartphone experience, I'm sure that many of you in the crowd have been communicating with your patients. You should be able to take your practice on the go, independent of your physical location, so that you're able to match up to how you want to practice medicine. One of the new features that we're really excited to announce for our platform today is advanced search capabilities. So as information is being collected about your phone calls, your messaging capabilities, you're now going to be able to search against that message content, not just the patient name, but complex information about what's happening in that inbox at your fingertips, on your smartphone, on the web experience, no matter where you go. Here's a little bit of a Spruce insight. So we aggregated all the outbound messages being sent by providers, and what we found is 1 in 3 messages that a provider is sending is an internal note on the platform. So that's like internal collaboration that's happening over your phone call events, your voicemails, your SMS capabilities. 30% of those messages are all internal collaboration, you working as a team to communicate with your patients, which was really fascinating to us because we knew that the team inbox would be valuable, but we didn't realize that so much of it would be internal collaboration that's happening on the platform. So let's talk about your phone system. Now, the phone system has been around since all right, there we go. The phone system has been around since the 1800s, and almost since the beginning, it's been a core part of how practices communicate. In many ways, the phone system is a clinical tool, yet the phone system has not been built as a clinical tool. So what does that really mean? So like I mentioned, all that communication that's being consolidated, that is patient PHI. That should be treated no differently than your medical information. And so what we do is we consolidate that information, make it digitally accessible to you in a secure format so that it's not left on your phone. It's left consolidated in the cloud for you to access no differently than your medical record. If you want to sync it to your medical record, go ahead. But if you think about it, that by itself is a communications medical record living up to how DPC practices are communicating today. When it comes to access and availability, you should think about your phone number decoupled from your phone system so that no matter where you go, if you're receiving calls at your desk when you're in the office, you should be able to press a button and receive calls on your cell phone at any hour of the day. After-hour workflows and business hours workflows should be something which you treat equally so that you're able to match up to the availability that you are, match up to the access that you're providing to the patients so that whether it's after hours and they want to call you and report an urgent matter, they're able to do that on the same phone number that you're providing to patients. Here's an example of Dr. Rob Boyer, who went on a hike over the weekend and was able to just take out his smartphone and change who was receiving calls so that his partner was able to cover for him instead of him having to be on his hike and hope that without cell phone reception, no one calls him. When it comes to your phone lines should not be thought of as separate from your clinical workflow tools. They should be embedded in them. And so one of the things that we do is we have the phone tree where you can actually create automatic tasks for however you design the phone tree. Let's just take the refill request as an example. You can have an automatic task created for the right member of the phone tree so that they can follow up with the patient and they can message the patient and close the loop in that format. Take that a step further, if a patient calls, leaves a voicemail, and you want to make sure that you are responding to patients within 5 minutes, be it a voicemail or a missed call or a message that they send in, you should be able to set up notification policies. So something that we're launching today is the workflow automation system, which is an incredibly flexible system that we've built, which makes it so that you can set up these rules-based policies for your communication capabilities. Backup system is something else which you're launching so that your medical communications are able to be highly accessible to your patients. Even if the internet line goes down or you're not able to access your Spruce inbox, you get inbound messages for incoming communication that's happening on your platform. My time is up, but I'd like to show you one last slide. We talk about telemedicine being about video calling, but here's just an analysis of 22 active DPC practices over the course of 12 months and shows you the distribution of communication that's happening. It's not about video calling. It's about secure messaging, calls, SMS. That is telemedicine. And video calling is right here, and these practices are communicating over video calling, but these different forms of communication really trump the way patients want to interact with you. So that's just something to keep in mind as you think about how your patients are interacting with you. Thank you so much, and if you want to learn more about Spruce, go ahead and text this number.